बिस्मिल्लाहिर्रहमानिर्रहीम नहमदुहु व नुसल्ली अला रसूलिल करीम अल्लाहुम्मा सल्लि अला मुहम्मदिन नबील उम्मी व अला आलिहि व अस्हाबिहि व बारिक वसल्लम। I am Professor Dr. Muhammad Anwar. Today I will talk about definition of diabetes mellitus, classification of diabetes mellitus, and diagnosis of diabetes mellitus. Definition of diabetes mellitus. By definition, diabetes mellitus is a state of chronic hyperglycemia. Deficiency of insulin is not an essential feature of diabetes mellitus. In fact, many patients of type 2 diabetes mellitus are hyperinsulinemic. Classification of diabetes mellitus. Classification of diabetes mellitus mentioned in American Diabetes Association 2017. There are 4 classes of diabetes mellitus: type 1 diabetes mellitus, type 2 diabetes mellitus, third is gestational diabetes mellitus, and fourth is a specific type of diabetes due to other causes. Type 1 diabetes mellitus due to autoimmune beta cell destruction, usually leading to absolute insulin deficiency. Type 2 diabetes mellitus due to progressive loss of beta cell insulin secretion, frequently on the background of insulin resistant. Third is gestational diabetes mellitus. Diabetes diagnosed in the second or third trimester of pregnancy that was not clearly over diabetes prior to gestation. Fourth type of diabetes mellitus is a specific type of diabetes due to other causes like monogenic diabetes syndrome, such as neonatal diabetes and maturity onset diabetes of the young, disease of exocrine pancreas such as cystic fibrosis, and drug or chemical induced diabetes such as with glucocorticoid use in the treatment of HIV/AIDS or after organ transplantation. Thank you very much.